What are the risk factors for ectopic pregnancy? Number one, if you had ectopic pregnancy before, all right, you can have ectopic pregnancy again. It's a risk factor for ectopic pregnancy, previous ectopic pregnancy. All right, anything that's happened before can happen again. All right. So number two is tuber surgery. If any time there's any surgery around the tube, like sapingectomy or maybe sapingostomy or sapingotomy, any tuber surgery or anastomosis around the tube, all right, it could cause ectopic pregnancy. All right, then tuber pathology, diseases of the tube, all right, maybe tuber blockage, um, fluid in the tube, kinking of the tube, all right, or maybe pelvic surgery, leading to distortion of the tube can also cause ectopic pregnancy. All right. Then this one is very important. This next one I'm going to mention is pelvic inflammatory diseases, PID. Pelvic inflammatory diseases is very important. That's why every woman, if you get any infection, you should treat it and treat it very well, because it could be a risk factor for ectopic pregnancy in the future. Pelvic inflammatory diseases can cause adhesions and eventually it can lead to ectopic pregnancy. Then intrauterine devices used for contraceptives can be a risk factor for ectopic pregnancy. Right, these are the major risk factors. Smoking is another risk factor. Previous pelvic surgery, any surgery at all, BU, cesarean section, any surgery that entails entering into the pelvic area can lead to ectopic pregnancy. Now, ectopic pregnancy is treatable because the two tubes, right? So if one is blocked or one is cut because of the ectopic pregnancy, the other tube can still function. So for somebody who had done ectopic pregnancy, they can still get pregnant. And sometimes in rare cases, maybe the two tubes have been cut, the person can still get pregnant through IVF, right? So ectopic pregnancy is not a death sentence to infertility. It's treatable. One can have only one tube and still be very fertile.